Patient Public Involvement PPI Fellow at the Center for Applied Health and Social Care Research at Kingston University in London, and Duncan is PPI lead at the Institute for Medical and Biomedical Education at City St. George's University in London. So the floor is yours, Victoria. Duncan, happy to have you here.
Many thanks. Thanks, Andreas. Thanks, everybody. Good afternoon. Yes, indeed, there is some overlap with previous discussions, and maybe we'll touch on some points and maybe answer some of those questions that were posed. Let's see if I can move this on. So that's not moving for me. Apologies, everyone. There we go. So today I'm going to draw upon a systematic review, just shown here on the slide, published by Rebecca Baines and colleagues, published in 2022. But neither myself nor Victoria were involved in this. We just wanted to flag it. The systematic review helps draw attention to how important it is to have involvement from everyone affected by digital health, and it highlights 112 different health topics across 42 countries where PPI, patient and public involvement, had been utilised. And the most often described topics included cancer, mental health and diabetes, so possibly indicating that there's a need for more PPI and cardio-related digital health research. The systematic review highlighted that there's no universally agreed definition of patient and public involvement and engagement, and this can make comparisons and drawing conclusions across other work very difficult. The definition recommended by the authors of the systematic review is shown here at the bottom of the slide, and it's one we would endorse. So it's patient and public involvement means actively working in partnership with patients and members of the public to plan, manage, design and carry out research. It is research or innovation being carried out with or by members of the public rather than to, about or for them. A variety of digital health innovations were identified in the systematic review, with mobile apps being the most frequent, then e-health interventions, web-based interventions, followed by e-health resources, robotics, and finally online platforms. Some barriers, frequent barriers to undertaking PPI highlighted in the systematic review included time and financial restraints, as we were hearing previously, the importance of data privacy and security, and the possible disconnect between the time taken to undertake PPI and product market launch. Failing to involve patients early enough in the design stage was a frequently reported barrier. In many cases, patients were not involved at all at the early stages. The benefits of PPI in digital health research and innovation included improved usability, insight into patients' needs and preferences, increased credibility and likelihood of digital health use, increased individual and collective empowerment, and the more equitable adoption and use of interventions by traditionally underserved populations. Early involvement, as well as a barrier, was also seen to be critical in preventing unnecessary resource expenditure and, importantly, reducing innovation refusal rates. The systematic review that we're focusing on here briefly has helped inform the development of an evidence-based practical toolkit specifically for undertaking PPI and digital health research. The toolkit emphasizes important principles for undertaking meaningful PPI to help encourage the involvement of everyone affected by digital health research and innovation. These are summarized in the ENACT principles shown here on the right of the slide, and it includes engage, acknowledge value and support, communicate, and trust and transparency. We don't have time to look at these in detail, but I encourage you to have a look at the link, which can be available later. Thank you. Excuse me. Sorry, over to Victoria.
Thank you. Returning to the question of how important is it to have involvement from everyone affected by digital health research, the answer is, of course, very. Otherwise, the result won't provide relevant answers, patients won't use it, and it won't provide benefits to the patients, so it will be a waste. Here we see the LBI's Digital Health Idea Competition in 2023, which was on developing innovative concepts together with patients, which stipulated working together with experts by experience. They addressed this in a very exemplary and to be applauded way. It marked as much as 50% of the marks for patient and public involvement, emphasizing the need for and importance of the involvement of lay people with cardiovascular conditions in the ideas process. This competition has resulted in a spin-off from the Heart to Heart team who won second place in it. They set up in March 2024 a workshop consisting of patients with CVT in London with the aim to co-design a smartphone app concept to build physical active social communities. Such a co-design workshop allowed the researchers to emphasize and connect with the participants and understand their needs in a very personal way. My personal PPI role involved actively encouraging likely participants to enroll and liaising with patient charities to publicize recruitment opportunities. Now I will focus on the British Heart Foundation, BHF. And here, firstly, the BHF are exemplary in involving their research with those who have heart conditions. They have a dedicated patient advisory group, PAG, to review research applications and their relevance to people with cardiac issues. An example of a BHF funded project to support the development of a digital health app is, as in this slide, a real-time ambulance to GP notification of atrial fibrillation, a digital solution to prevent stroke, which has now secured BHF funding. The example is shown from my own expert by experience reviewing of BHF funding submission process during my time as a patient advisory group stroke survivor member. The application proposed developing a new tool within the existing ambulance electronic patient care record so that it can automatically send a letter to the GP with the electrocardiogram attached. The implementation and management of the project will be informed by 2 PPI representatives who previously helped inform the planning phase of the project. BHF are also exemplary in the ways in which they support their patient advisory group. For the Healthcare Innovation Fund, they produced a video to explain the reviewing process to the lay members of the PAG, and they were constantly available for any queries on the applications. This is a good example of the ENACT principles in action that Duncan highlighted earlier in the toolkit, particularly around engaging and communicating well with members of the public. Back to Duncan.
Thanks, Victoria. Another point made in the systematic review that we highlighted earlier is that children and young people could be involved more at an earlier stage of projects, which would allow for their involvement in the planning process of digital health research and innovation. We turn now to briefly highlight some of the children and young people's PPI work that we've been part of in the form of a Young People's Advisory Group, or YPAG, set up in the southeast of England. With a small amount of charity funding, we helped establish in 2017 a young people's advisory group that meets online or at the Children's Hospital in Brighton to provide the voices of children into the development of new paediatric research. And our YPAG is affiliated to Generation R UK group of YPAGs. In 2019, 25 children and young people, including from our YPAG, travelled to Great Ormond Street Hospital's new Digital Research and Informatics unit called DRIVE, which stands for Digital Research, Informatics and Virtual Environments. And it's a partnership between GOSH, University College London, NHS Digital and industry experts in digital innovation. During the day, the children and young people took part in 4 interactive health tech workshops where they met and advised digital researchers and industry colleagues to help them think about how their products could be improved to better meet the needs of children and young people. The industry partners included NTT Data, Microsoft, and Samsung. The 4 workshops included robotics, gamification using Minecraft, mobile devices, and augmented and virtual reality. During the robotics workshop, Navi, Sota, and Jibo were all presented, and some of these may be familiar with you. Focusing briefly on Jibo, it is described as a social robot who looks, listens, and learns, and has a unique 360-degree movement and personality. The children and young people then asked the following questions of all the technology they experienced in the workshops, and these might be useful for you to consider in your own PPI work. For example, what concerns might you have using this technology? What other features would be useful for patients like you? We don't have time to look in detail at the types of feedback the children and young people provided, but one brief example from the Jibo session was that children thought that Jibo was possibly easier to talk to than a doctor and was possibly less embarrassing. The next slide shows a poster produced by members of our YPAG and which was presented at the 2021 International Children's Advisory Network, or ICANN, Summit. Over to Victoria.
And this shows the involvement of YPAG in several digital health research projects presented to the group. For example, the GOSH Minecraft project to help children and young people prepare for a hospital visit, and Champions of Schengen to help children and young people with their breathing and emotions. Also, Professor Paul Seddon is a Brighton-based clinician and researcher and a founder of this YPAG, and he presented the Project Breathe app, a home monitoring app for children with respiratory problems. It's shown on the bottom left of the poster and captured on the next slide. And this slide shows Professor Paul Seddon's presentation of the app idea to YPAG. And then the next slide shows the types of questions which Professor Seddon asked the young people, and they highlight a focus on the early design stage of the app development. One of the questions was, what would be the best way to involve young people in designing the app? And now back to Duncan.
Thank you. The benefits of patient and public involvement to digital health research and innovation extend beyond the development of the new digital health technology itself. After attending the GOSH Digital Drive workshop, one of our YPAG members, whose name's Kit, said, and the quote's here on the slide, "It helped me realise the technical advances that are currently happening in medicine, and it allowed me to have an input, however small, to do with very important new technologies." So this helps highlight the benefits to members of the public, including children and young people, of being involved, and not just the benefits of the innovation itself. So we hope we have introduced you to the importance of involving everyone affected by digital health research, including children and young people, who are a next generation of users, innovators and researchers, and therefore it's important to include them as PPI representatives to help ensure that research and innovation is carried out with them and not just about them. Thanks very much.
Thank you.